Get Sweaty with Leddy, a wellness program about pain management.
Welcome to today's episode. We've got another weird winter day here in Minnesota. We've got sun, which we don't really have, and you got other parts of the country that are getting hit hard with snow that aren't prepared for it. Los Angeles is on fire. It is truly a very weird feeling around here, but that's not going to stop us from the task at hand of fighting pain. So let's head on up to the sauna and meet today's guest. Welcome into the sauna. I'm sitting here with a good friend of mine, Reid Nelles of Minnesota Movement. Mm-hmm. We met just this last year. We had some like-minded people that were like, you guys need to know each other, and sure enough, we absolutely needed to know each other.
Yes, yeah, worked out well.
Yeah, and we were able to team up on Spring Park Awakening, where Reid did a movement flow session, which was awesome. And that's what Reid is. He's the king of movement.
I wouldn't go king. We got to drop the ego a little bit.
All right. The prince of movement?
Sure, I'll be the prince.
And Reid is one of those people that, he's not a chiropractor. He's someone that has to practice with a chiropractic license. So I'm really excited to continue to teach everyone the difference between the two, because there is a huge difference, and Reid is prime example of that. You know a little bit about my injuries. Well, Reid has a very similar story, but he achieved all the same injuries in a different way.
Yep.
So Reid, what brings you into pain?
Yeah, a lot of things. Life.
Yeah.
Glad to be here. This is awesome. I love saunas, so
yes.
This is my favorite. I can't wait until we get really sweaty in here. On the chiropractor, having to practice as a chiropractic thing, I'm really a movement advocate. Anything that gets people moving, doing what they want to do, and there's so many different modalities that we can do with that. So with the pain side of things, if we're in pain, our brain really doesn't care what reason we're feeling pain from, whether that's chemical, emotional, social, psychological, or physical. Most of the time we think about physical pain, but if my heart breaks, and we hear about this all the time with elderly couples, one passes away, the other one dies 2 days later from heartbreak kind of thing, that could be emotional, that could be social, that could be psychological pain that somebody's feeling that represents as a physical manifestation. Unfortunately, death, but still the same thing applies. We can get into phantom limb pain and all that fun stuff, but really it's getting people to move and feel the best way possible by whatever means necessary.
Right. Oh, and I like how you're bringing up the psychological component, because the first thing that people do think of when it's pain is that physical sensation or visible in a sense too,
Yep.
And it is most definitely, it does not stop there.
No, and knowing your story, my story, to kind of segue back into that aspect that you brought up. So I grew up as a competitive snowboarder. I played all the normal sports, football. I suck at basketball. Did not play basketball. Not a basketball player. Yes. No, I didn't dabble in hockey either, though, because small town, no real hockey team, etc. So football, baseball, and track. And I did baseball and track at the same time, because small school, you can do both sports in one season.
That's what's up.
But snowboarding was my winter sport. And through snowboarding and having an older brother, myriad of injuries. 9 grade 2 or above concussions. I was in a coma for 7 days. MCL, ACL, LCL. Compression fractures of T7 through 9 twice. 7 broken ribs. Broke my nose 4 times. Again, older brother.
It looks good though.
I was wrestling my dog. So cool sidetrack story with the broken nose. Talk about sense of identity and everything else. For a long time I was Owen Wilson, right? All broken one way. I was wrestling with my 100-pound golden retriever, and he came in one way, I came in the other way, and just smashed my nose back, and immediate big loud crack. My wife comes running in and she's like, "Is everything okay?" I'm just blood everywhere. I'm like, "No. I can breathe now. This is awesome." Give my dog a big pat, and I was looked in the mirror, because seeing how bad it was kind of thing. I'm like, it's even. This is awesome. So through all those injuries, kind of the relation here is when I was 15, snowboarding, tried to make a road gap, made it successfully a few times. but it's always the last one, right? Snow slowed down a lot. Sun came out. Things got a lot slower. Landed on my back in the middle, not in the middle of the road, almost across the road. But yeah, it was basically a burst fracture is what it was. So we had this pars interarticularis fracture, which is so the definition of a spondy. So spondylolysis is a fracture of some portion of that vertebrae. Can technically happen anywhere. I'm guessing yours was L5.
L4, L5.
L4, L5, yep. So mine was L5. Basically the back circle, if I could use both my hands, the back circle of that spine broke upon that landing. Well, I just landed on the road. So like my back hurts, that makes sense. My butt is all bruised. I didn't go in to get an x-ray until it kept hurting about 3 months later. 3 months later, they're like, yep, you had a burst fracture. We don't know how you're walking, this and that. With that spondylolysis, the fracture, you can get slippage. So like there's no structural stability there. All your muscles and some of the tendons and ligaments are holding things on. So that segment slipped forward on my tailbone. I didn't have any major, like after about another 3 months, like it felt better. The bruising was gone, which was awesome. Everything felt better, but like as we get older and continue to load and I continued to snowboard somewhat competitively up until about 19, the coma incident.
Man.
And I wasn't great by any means, right? I was early adopter to the sport. Like I ended up coaching for a long time, pro-am kids, and like seeing these little 16-year-old kids like do things way better than me. I was like, yeah, I'm glad I got out of this. I'd rather be a coach at this point. But yeah, so now fast forward to just over a year ago, October of last year, I was putting my daughter in the car seat, and with this slippage forward, it's been stable for a long time, and I've been an athlete my whole life and kind of been working on it. The right storm clicked, and I was putting my daughter in the car seat. She threw a little, not temper tantrum, she's a sweetheart, but just this little wiggle, goofing around, and I dropped to my knees.
Oh.
So I had a 13 millimeter disc herniation last October, and that's been a mess with the sense of identity of being somebody who wants to, hey, Reid, do you want to go wake surfing? Yeah. Do you want to go mountain biking? Yeah. Do you want to go bowling or underwater basket weaving? Yeah. But like not being able to do any of that, like it really racks with you. So
no, I can totally relate. I've had so many periods of my life where I've had to completely pause what I'm doing, even as I'm just like in the flow of it.
Yep.
You know, I mean, I'm dealing with something right now where I went down a couple weeks ago, or not a couple weeks ago, but a couple months ago playing hockey. I was trying to do too much. I'm still learning how to play as an adult.
Yeah.
I'm not a 20-year-old. I'm a 40-year-old.
the 100 miles per hour doesn't work as much anymore.
Yeah, my reflexes are still there, but you know, my thought process for the reflexes is there. But then all of a sudden, like I do something and, you know, my body hasn't responded.
Yeah.
And yeah, the knee thing then led to a little, not necessarily a disc thing, but I had a nerve thing going on. Fortunately, it wasn't like disc movement.
Yep.
But it just bounces all back and forth, and I'm still dealing with it, still trying to retrace how I can fix myself.
And that's the like two things to think about there is like humans are great compensators. Like we're the apex predator critter for a reason. Like we're super adaptable. And we can have a blown knee. I mentioned my ACL, MCL, LCL thing. I never had surgery on those. Not because I didn't want to, but because like it wasn't warranted. None of them were full tears, by the way, for what it's worth.
Nice.
Yeah, so I got away with that. But, like we can adapt. But if I walk, like you'll see my right foot sticks out like 10, 15 degrees. And it's just an adaptation. With one of those, I also had a spiral fracture in my tibia, so that might be a little bit of that. We can adapt, and I don't feel any pain in either of my knees, deep squats, everything else, but we can also maladapt or otherwise compensate, and we can have a knee issue that eventually like, hey, dude, my knee feels fine a couple months later, but now my opposite hip, my opposite shoulder,
bouncing
back
and
forth. The second piece on that is like having rationale. Like if something just starts hurting out of the blue, we get really frustrated. That's confusing. Like I've been squatting, I've been playing hockey, I've been doing whatever for months and months and months. How did this just start happening? Nothing else changed with that system. And like that straw that breaks the camel's back, it's much easier to like mentally rationalize, I got hit by a car. Josh punched me in the face. That's why my cheek hurts. Like that's the easy stuff. When things just come out of the blue, when we're 40 or 45 or 50 or 22, it doesn't matter. Those are the confusing ones that really mess with the personality side of things.
Yeah, and that's where, leading up to that, people they're not thinking about their pain. They're not thinking about their body. They're not necessarily fully in tune with it. Maybe they are taking just some over-the-counter pain pills because they think it's fine. Maybe there's something else that is masking the feeling that's there. And then all of a sudden you totally forget about it. And your the compensation has made you think that it's gone.
Yeah.
And it's really just secretly moving all over the place, only to arise at a later date when you completely forgot about it and don't know how to
kicking the can down the road. Yeah.
Yeah. You said you tore those ligaments in your knee and you didn't have surgery. Maybe you would have thought of having surgery if you were really trying to compete at the high level, but think of the percentage of people in this world that compete at the high level.
Yeah.
Not many.
Not many.
Yet there's so many people that just go and have surgery to fix what they have torn, right?
Yep.
And, you know, when you have that surgery, you're still going to go and have all the rehab, but you're also going to have somebody go in and cut you up, and then there's going to be scar tissue, and that is going to cause problems in its own right. That scar tissue, it's going to eliminate, it's not going to create a proper flow of communication. It's going to muddy up the works.
Yeah.
So if you can prevent surgery by just getting out in front of it, moving your body the right way, strengthening it the right way, you can still be fine and avoid all that surgery.
And that's where, like, I'm not on that subject. Like, I'm not opposed to surgery. Like, there's a time and a place for it, right? And like, I always bring back with the knee situation. Like, mine wasn't. I went to many surgical consults. I tried adamantly, especially for my ACL, to get surgery. That one took a long time. It was ACL and MCL at the same time, and I was trying. The surgeons were like, "Hey, you're young enough. You're athletic enough. Like, we don't have a lot of instability here. We can rehab this." And this is before I got into like the whole rehab side of things, which we can go down that rabbit hole of my story of how I got into this profession too. But I always bring up the story of one of my buddies in chiropractic school. We were going through like all the orthopedic tests, like, oh, here's the Yeomans and empty cans for the shoulder, and here's this one for the hip, and here's this one for the knee. It's drawer test, like Lockman's and drawer test, like the two most positive ACL, PCL orthopedic test for the knee. And I grab his knee. He's a bigger dude, played basketball up in Canada. Hey, Canada. And I grab his knee and it just goes schlunk, schlunk. He like looks up at me. I'm like, did you tear your ACL? He's like, I don't think so. And like, call the professor over and it's just sloppy as all get up. And I've felt many ACLs since then. This still, like, I can vividly remember of just how sloppy it was in there. Guess what? This dude had zero pain, just got done playing basketball at a high level at university up in Canada. Like, he was fine. We don't need surgery for every single thing. And it's kind of that easy way out, right? Sometimes. And again, there are times and places for it, but they do cut you open. They still get into these things. And we have that repair and healing factor to mess with physically and mentally as well.
Yeah. I think there was a guy just, I can't remember what team he played for, but I just read, I think it was maybe yesterday or 2 days ago, there was a college football player that played the entire season with a torn ACL and did well.
I mean, shout out David Montgomery coming back with an MCL. Detroit Lions, let's go.
Oh, don't get me started on
Sorry, Josh.
Football talk right now over here.
The other aspect of that, like with the surgery, non-surgery, you mentioned like strengthening things. I'm a big fan of there's no such thing as perfect movement, right? Like, we're amazing little critters, humans are, right? Like, we should be variable in being able to adapt to certain situations. There's no such thing as a perfect exercise. There's no such thing as perfect posture, positioning, or form. Now, there's better, for example, like a deadlift. If I'm going to deadlift, you guys can see my legs. I can't deadlift 500 pounds, but if I was going to, there's a better form for that, right? I shouldn't be rounding my back and things like that. But with my two little kids, 6 and 4, I should be able to pick up a 40-pound kid with a terrible form without blowing my disc. Now, of course, that just happened to me a year ago, right? I don't know what my form looked like. I was putting my kid in the car seat, right? But like, something went wrong at the wrong time, perfect storm. And we can't get too caught up on like how that happened and never do it again. Like, we should become more and more tolerant and increase our threshold or our ceiling away from the floor to get more adept at doing crappy things without pain and discomfort.
Yeah. And it's like, you know, a lot of people, I would imagine they would have a similar situation like yours where they bend the wrong way, they hurt themselves, and then they go into complete rest mode and don't do anything. And that's exactly what you should not do. And, you know, it's just, go see somebody like Reid who's going to get you moving in the right way.
100%, yes. Come see me, 261 School. Anyways. Or just start exploring, right? Like, if something's, I always tell people, like, never push past pain, right? Especially in the acute phases of an injury or a flare-up or something like that. But, like, we need discomfort. Pain is a good thing, right? And we talked about this earlier. Like, we learn so much from pain, whether that's emotional, psychological, or physical. Like, if every single night I walk up in the middle of the night because I got to go pee, right?
Yeah.
And I kick my toe into the same coffee table every single night. What does that teach me? Either walk around or move the coffee table.
Yep.
Right? Like, pain is a learning moment. If every time I date somebody who seems toxic and all my friends are telling me, like, don't do that, dude. I've been married for 12 or 10 years now, so I'm not in this dating scene anymore. But, like, everybody's like, hey, that looked a lot like the last girlfriend, da, 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 and it ends up always terrible. They always cheat on you, whatever. Like, you learn from that heartache, the emotional and social stress of that. Like, pain is a learning moment. We need pain in our lives. So when we're rehabbing something or exploring movement, whether that's avoiding surgery or not, like, go to discomfort. Like, if we never challenge the system, we're never going to change the system, is like an overused cliche quote, but we need to challenge that system. If all we do is rest and sit there, yeah, you're probably going to feel great, especially if you're loaded up on ibuprofen or something like that. Like, you're probably not going to feel as bad,
right?
But you're not testing it.
For sure.
What kind of life is that?
For sure. And, for me, pain has defined my whole entire life for the most part.
Wrote a book on it, guys.
Yeah, that's right. But I still appreciate it,
Yeah.
Otherwise, I would maybe just get too complacent with life and not be as proactive as I need to be. So pain is just this subtle reminder of, hey, get back on track and think about what you're doing.
Yeah, I mean, like, pain means you're alive. That's a good thing. It's a good problem to have, right?
Yeah.
And then on the complacency side of things, like, absence of pain, absence of soreness, like, we all agree, minus menstrual cramps, I'm not a female, but, like, cramps are uncomfortable. If you get a Charlie horse in your calf or your hamstring or something, that's uncomfortable. But if we're looking at, like, exploring movement, getting this crampy engagement feeling or a stretch feeling that might feel searing, like, some people irrationally think that's painful. It's like, when I'm in the clinic, I'm always like, hey, what do you feel here? I'll get somebody into a deep stretch or, like, some sort of FRC protocol, something, functional range conditioning, and they'll be like, oh, I don't feel any pain. I'm like, good, you're not supposed to, right? Like, what do you feel here? Like, it itches here, it burns here, it feels like a searing, stabbing, engagement, whatever it is, cramp. I'm like, awesome. Like, it's okay to feel other things that are uncomfortable, because, like, if I start cramping in a muscle because I'm trying to pull it to a fully shortened range, that's very uncomfortable. It feels like I'm going to lock up, right? Yeah. But it's not painful. It's like rationalizing that and understanding how our bodies that are moving and, like, being more connected is really what it boils down to, like you mentioned with the knee. So, yeah.
Right. What point did you just decide, you know what, I want to get into the world of pain. I want to get into helping people. Was it, how did that happen for you?
I was born into this.
There it is.
Minus the Bane reference there, the pain started early, right? So, like, through the easy answers, like, hey, you've had all these injuries and your upbringing, like, most of which happened from, like, 12 to 17, right? When you're trying to figure out, like, what am I going to go to college for and things like that. And don't get me wrong, that definitely helped, like, through my experiences of going to PT, seeing these surgical consults and having a couple smaller surgeries and things like that. It definitely inspired me, but I always give credit to my human anatomy teacher in high school. I was not a complete shithead in high school or in middle school, but, like, I have ADHD, so, like, a lot of teachers don't know how to handle that. Fell into the hands of Miss Noel, so shout out to Miss Noel. So Miss Noel kind of guided me. I still go back there every year and teach, do a guest teaching class, so it come full circle. But she kind of, like, took those reins and, like, hey, have you ever tried anatomy stuff? And, like, I always joke, I'm a good student, I'm pretty smart, but I'm not super smart. I can't read worth a darn. My wife picks on me all the time, it takes, like, way too long to read a book. I'm a super slow reader, but picture books are a lot easier than word books. So anatomy really clicked. And then the idea of wanting to help people and, like, being the entrepreneurial side of that. As a kid, I always had my own lawn mowing business, like every kid does, but it was actually, like, successful. And, like,
nice.
My dad ran, like, a small company growing up. So just having that kind of ability and wanting to do whatever necessary for the person, like, I never once thought about working for somebody else. I don't like that idea.
Hey, props, because that's exactly my whole entire life.
Yep.
There was never any train of thought where I was like, I'm going to get a job. Matter of fact, I got tattoos on my arm here because when I was going through a massive depressive state after the bulk of my early injuries, I was like, you know what? I don't want to ever work for somebody that would think that this is bad. Yeah. So it was basically me getting out in front of it and saying, I mean, like,
your tattoos are about the same size as my tattoo too. So, I mean, we're pretty much the same there, right?
Like, that's a ripper right there.
Yeah, that's a big one. But nice. It means a lot, so.
Oh, that's super cool story. Because, when I was going through all of my injuries early on, broke my back, found out I had spondylolisthesis, 3 ACL surgeries. After that first ACL surgery, I was thinking, oh, maybe I want to be in physical therapy, or maybe I want to do this. Maybe I want to help people. And, then I get through to my point where I'm done playing hockey. I didn't choose to be done playing hockey at the time. But that's where, like, you know, if I wanted to get into it at that point in time, my brain was so rewired because of pain and just depression. Yeah. You know, it was really hard for me to like get over that next hump. So, you know, I just more or less kind of commend you for finding this path early on, because, you know, I still had to go through a significant amount of time before I figured out what my purpose was. You know, I love bringing people together, hence the brewery. I love physical labor, because, you know, hence Life's a Beach and all that. Ultimately, it's my destiny is to sit here, have these conversations, and put people in a state of comfort.
And like bringing people together. This is, whether it's via this form, you guys watching, listening, etc., or being together in this room with you, like that's bringing together. And that's where I think finding that purpose and finding that identity of like, when we're going through all these trials and tribulations of like, now I got no knee and I can't play hockey, not by my choice. Right? It wasn't a conscious decision or a conscientious decision. Like, how does that mess with you? So like, I want to kind of flip this back. I get to interview you here a little bit. Like,
let's go.
With that depressive episode, we'll call it, or moment in life, like, was there anything that like brought you up from the ashes, like a phoenix kind of thing? Like,
yeah, it was this, you know, this kind of hidden identity of me being an athlete, because I was a team sport athlete, played hockey, baseball, all the things. And when a former teammate of mine came back and wanted me to be, he was like, hey, do you want to do this together? Which was resurrecting Life's a Beach. I had to take a 2-year hiatus after I started it when I graduated high school, because, you know, back-to-back ACL surgeries will do that to you. But it was just this sense of teamwork, and then it was being outside, natural light in nature,
being physical,
moving my body around. And granted, you know, for me, moving my body around wasn't necessarily the best, because then it uncovered a torn labrum in my hip, partially torn hip abductor muscles, hip dysplasia, and then my fun time with herniated discs and nerve pain. And, you know, I will say that there is no pain like nerve pain. Yes. And that will change your life. When you had your spondylolisthesis, did you have nerve pain going on, or what was it for you?
At 15, when that initial burst fracture spondylolisthesis happened, that slippage happened, I didn't have any pain. Right, like there was no radiation, anything like that. And then that straw that broke the camel's back last October, that's where it debilitated me. I mean, that nerve pain, Josh is absolutely correct. There's nothing, and we've been through a lot of pain, right? There's nothing compared to nerve pain. And I thankfully have never had any upper extremity or like anything else. Like we know like TMJ jaw pain and things like that shoots, or like migraines, nerve pain. I can only imagine if it's anything like my disc, that is miserable. And I will, like, if anything, it taught me to be more empathetic to those who I'm working with, which I'm an empathetic person to begin with, but like now I know, right? And being able to take their place a little bit per se. So
yeah, one of my gifts that I realize I have is being able to recognize people in pain. And I see so many people that come through back channel here, and, you know, I could just walk people through and I could just label them. Like what's going on. Maybe how long. And the worst part about it is sometimes these people don't even know how long it's been going on, because they're conditioned that this is who they are. This is how they move, and they can't pinpoint when it began. And it's so sad. And that's where, when I was kind of able to pick up the pieces of my life and get on the right track of the nerve pain and my disc problems, that's where I had that realization where I was like, you know, I need to help people.
Right.
People need to know about opportunities that's going to change their life.
It really becomes like a safe space, right? Like if you can align with somebody else who's been through it, or like I think what's sometimes even more important is somebody who's in the middle of that journey. Like, hey, I was there 2 weeks ago and now I'm here, and I'm not 100% yet, but like we don't even know what 100% is, and like continuing to chase that wolf down kind of thing. So
yeah, and the weird thing for me, which is, you know, I always knew I wanted to write the book, but this was extra oomph to write the book, was people didn't believe me that I was in such pain for such a long time. They're like, well, look at you look great. I'm like, well, this is what I got to do to fight pain. You know, I can't just be sitting here drinking beer from the taps every single day and having food truck food and just think that I'm going to be okay. I got to take advantage, or I got to own my shit.
you got to fight that head on. And that's where, like, we talked about that earlier of, like, exploring and pushing towards discomfort, not outright pain, but, like, increasing that threshold. And that's where I think you start to get your identity back. So for me, and I know this is kind of where you're leading into, like, when I herniated, so no major issues when I was 15, had that burst fracture. Prior to that was one of the compression fractures in my thoracic spine, a couple broken ribs, wrapped a snowmobile around the tree at 19, broke some more ribs, some more vertebrae, punctured a spleen, super fun, out in the middle of nowhere with no ability to get to a hospital.
Damn.
It was there was no surgery with that one, which was good, but healed itself. But, like, all those injuries stacked up, but I was still 19, 20, 21, 22 years old. Like, you bounce back pretty good. So this last year where I herniated that disc, and I was out for 2 weeks, right? Like, could barely wipe my own butt, like showering 5 times a day just to get hot on me. Like, there were saunas around, but I couldn't even drive to get to a sauna kind of thing. But, like, that constant heat just felt good. So it was miserable. Taking off work, not being able to help people, which is my passion and purpose, like, not feeling worth anything because I'm not doing anything that I'm passionate about. I mentioned earlier I'm a yes man. Like, hey, Reid, do you want to try out this? Do you want to play pickleball? I've never played pickleball, but let's do it. Like, anything. I was saying no to things relentlessly, and, like, didn't go skiing or snowboarding once last year with my family. Like, granted, we didn't have any snow either, so that was okay. Also didn't have to shovel. Big win.
That was a big win last year.
When you take away all those things that you identify as, of being a yes person, being an active person, being able to help people and being passionate about that, that's when it started to demoralize me. So those first 2 weeks, all I could think about was pain. It was about 2 or 3 months later where I started seeing a therapist specifically for that reason. Had been seeing one before, but, like, really just being vulnerable and sharing that experience and sharing that with patients, and still sharing that with patients. Because same thing, people look at me. Yesterday I had a patient in, acute low back pain, probably likely a disc bulge, nothing major, but definitely there, shooting down the leg mildly, but only in positional changes. And I'm like, hey, I've been there. And he's like, what? I'm like, yep. I'm like, if you want to see my MRI, he's like, no way. Like, you can't move that good after XYZ happened to you. I'm like, you can if you trust that process and push against it. So that psychological aspect is really what I try to lean into more and more. Even prior to this instance with me, I really try to draw that out of my patients and clients. Like, what does this mean for them? What's their goals, and how is this really affecting their mental status, not just their physical status?
Yeah, a lot of time when you're in that pain, that you're just stuck thinking about it. You're not even recognizing the small victories that you have.
Yeah.
And that's so important. If you can think about the small victories and think about how you're going to feel as opposed to how you have felt.
Yep.
That's the first step right there.
Yep.
Trusting in the process.
Yep.
Because nothing is going to be just this instantaneous. I bet you've never come across somebody that's come in there with some big pain and you do your magic, you get them to move, and then they're not better instantly, right? So it's a process.
It's funny you say that because, like, on the chiropractic realm, I always tell people, like, they'll come in and be like, 2 things happen, right? I've never been to a chiropractor before, I don't trust you. I'm like, that's fine. And we can get through that. Or they hear, like, oh, my buddy referred me. And I have, like, this one patient that I always bring up. I can't mention his name, obviously, but he refers a lot of people. He got better in one visit. And so he refers in a lot of people and tells them, Reid got me better in one visit. I'm like, dude,
don't
stop saying that. Because, like,
Yeah.
that was a snafu. Like, that happens, don't get me wrong. That happens, and it's a miracle. But usually that doesn't happen, right? Nor will I ever fix 100% of the people that walk through my door. I'm not the answer to everybody's problems, right? The second thing that happens is, like, they've seen somebody and they've got better. I'm like, hey, I'm a chiropractor, not a magician. Like, I can do what I can do. I can't do what I can't do. And I can't just snap my fingers and take that away for you. Trust me, as an empathetic person, I wish I could. And that's, like, the hardest part for me helping people is, dare I say, like, burying that or carrying that weight. Like, I see some, don't get me wrong, I love all my patients. They're fun. Most of the time we have good conversations and enlightening, hopeful, inspiring conversations to get them out of that pain. We try to curate that as much as possible.
Yeah.
But I also hear some shit. And, like, I'm almost pseudo, good thing for my psychology minor in college, like, I'm almost pseudo their therapist at times. And, like, when I get home at night, like, don't get me wrong, I want to see my wife and kids and stuff, but, like, I savor that 15 to 17 minute drive home just to, like, decompress of, like, wanting so bad to take these people's pain away for them and trying my best to do so therapeutically, treatment wise, etc., conversationally. But, like, it's hard seeing people in pain all day. So, yeah.
Yeah, it's a powerful statement right there. You know, just you taking your work home with you. A lot of early on in my pain management exploration, when I was seeing, you know, the people that call themselves chiropractors and not that, you know, the bad ones in my mind were just want to lock me in for 10 visits, you know, and then they're I'm in there for maybe 10 minutes and I'm just like, you know, part of a drill in a sense.
Like machine, a cog in the wheel. Yeah.
They're not going home thinking about me.
No.
They're probably just thinking about how many patients they got in today.
To be fair, right. And to be fair, this is not just me playing nice in the sandbox. Like, I always tell people who kind of bash the traditional chiropractic thing, like a 5-minute session, crack them and stack them. The joke in our business is like cracking necks and cashing checks kind of thing. Like,
I like that. I don't like that, but
no, but like there are people who do that. Do not get me wrong. But there's shady people and shady businesses across every profession, right?
Yep.
Chiropractors are notorious for them for that reason. But my kind of barometer of success of those individuals is like, if they've been in business for 5 years, 7 years, 10 years, 40 years, like they're clearly getting some people better, right? Mm-hmm. You trust me, business is hard enough, especially in the chiropractic world of things. Like, you would not stay in business unless you have like a trust fund to bank upon for 2 years if you're not getting people better.
Right.
Like, if you are just purely cracking necks and cashing checks, people are going to sort that out pretty darn fast and stop coming in. So there are those traditional chiropractors who do get people feeling better, but there's a missing piece, right? Like, if it's a muscular tightness issue, an adjustment to the subluxation of C1, C2, like that could help, don't get me wrong.
Yeah.
But what else can help? Let's strengthen this shit. Let's mobilize some stuff. Let's make you more tolerant and hard to kill, really. So
yeah, and you know, I have a unique story. We'll meet a guest down the road that's in my circle of pain. One of an ART specialist that I work with, active release technique. And she told me I can't remember the story exactly, and I don't want to speak for her.
Yeah.
But she basically was learning, and she had asked a question to the like an instructor, like, well, why don't you do this? And the instructor goes, well, then they're not going to have to come back as fast. And
red flag.
For her, she's like, are you fucking kidding me?
Yeah.
Did you just say that to me?
Yep.
And
which is a good way to think about it. Like, I always tell people, if I'm doing a good job at my job, whether I'm training you, whether I'm treating you, whether I'm talking to you, if I'm doing a good job at my job, what's the end result? You get better.
Yeah.
If you get better, what's the end result? You stop coming to me. Like, I don't want to see you 3 times a week or 3 times a month or 3 times a year. Like, ideally, I don't see you. Yeah. That's my end goal.
But at the same token,
unfortunately, there's no money associated with that.
Right.
So I'm never going to be rich, but I'll be very happy.
At the same token, there's the thought process of trying to optimize your body.
Right.
You know.
Yep.
So I hope people don't get better, and then they're like, all right, cool, I'm never going back again. You know, because I'm good. You should see it as an opportunity to get better and be like, all right, I'm going to continue to train my body here. I'm feeling good. Maybe I'll go and get a tune-up later on and just check how everything's going. Keep monitoring the process.
End result is people are pushing their boundaries and continuing to challenge themselves. Guess what happens when we challenge ourselves?
You get hurt.
We get hurt, right? So like, there is a job security component to that.
Yeah.
But it can't be a forced job security. I don't want people to stay hurt. I want them to push their boundaries so that they get potentially a new hurt because they're pushing their boundaries and they're exploring and they're increasing that threshold. So,
is there a time of year when you see more injuries than others? Because we're in the beginning of 2025 right now. Got a lot of people that have been trucking along in January, and maybe
New Year's resolutions.
They were probably, I feel pretty good now. They had 4 weeks of working out and they're feeling pretty good. Or you got the others that are like, I want to keep doing this, but it's just hurting.
Yep.
But then they maybe got a spring break trip coming up and they want to power through.
Funny thing about like New Year's resolutions is like, in theory, we'd see a lot more people like, I'm going to jump back on the elliptical or start training or train for a marathon or whatever it is. We'd think we'd see a lot of these like, owie, it went from 0 to 60 too fast kind of injuries. Mm-hmm. What's the other big resolution? Saving money. And people don't want to prioritize money on themselves. So like we do see like a net equal kind of thing through January, February with that. But
interesting.
Overall, Josh, I'd say like there's definitely times of seasons where we see more commonly an XYZ injury, right? So like hips and knees, we usually see more in the spring and early summer because people are going to get outside and start running and they're going to start wave surfing. They're going to start doing a lot of these outdoor summer activities. Don't get me wrong. We see the skiers in the winter with knee injuries and hip stuff too. Shoulders and low back is usually winter things. Shoulder is the interesting one. Is like we use our shoulders in the summer too, but people put it off because it's summer and we only get 3 months of it here in Minnesota, so they put it off until the winter happens.
Well, yeah, you got to smack the volleyball.
Yep, you got to smack the volleyball. You got to throw that baseball to your kids for practice pitch and all that fun stuff. So yeah, they always put it off until kind of fall, winter. So
interesting. Well, it's good to take note that take care of yourself all year round, and you won't have to worry about peaks and valleys of hurting yourself. I used to hate the winter because I would see it as how am I gonna stay as in shape, you know,
Yeah.
and I would maybe either
You're
not
saying, like,
do
without
enough.
hockey?
Well, for me, like for a few years,
Yeah,
when
yeah.
I mean, I wasn't playing hockey for like 10 years.
Yeah.
So I would have this, you know, this ebb and the flow where I'd be great in the warmer months, and in the winter months, I would kind of like settle back into a comfortable routine. Yep. And then all of a sudden, you know, springtime comes around, I'm like, fuck, I got to get myself in gear again,
yep.
you know? Whereas now I put so much emphasis on simple yet effective movement that I don't need to rely on something vigorous like hockey to maintain my body. I can maintain with just simple movements, 30 to 45 minutes a day every morning.
I was just going to say, like, I challenge anybody who's like, oh, I need to work out for at least 45 minutes. Like, shoot me a DM, call my cell phone, come in for 5 minutes, you will be gasping for air, right? Like, and it's not gasping for air because I'm just going to kick your cardiovascular system, right? Like, you will be sore the next day, you'll be everything else. There's always a way to get simplified movement into being better, right? Mm-hmm. So there's a big part of that.
Sweet. I love it. You know what? You know what's gonna make us even more better right now?
Jumping in some cold water.
Let's
do it.
Now that we're good and sweaty.
Oh yeah.
Let's go get cold.
Awesome. Let's do it.
All right. Time for a nice little cold plunge. Thanks for clearing that hole again, Isha. Oh yeah. Just how I remember it. Good cold. Face first, I like your style.
There is a rung down here?
There's a rung.
Okay.
Little mucky down there. You could use the muck as insulator for the feet.
I can't touch it.
It's also a good exfoliation, right? So you're getting some, yeah.
I can't touch it.
Oh, you can't touch it? Okay. Hammer time?
Hammer time.
Can't touch this.
Oh.
Cold plunge time. You get it now?
Oh, still too short.
All right.
I can feel something down there.
Maybe it's from people kicking like crazy. They come in and they panic in a
shivery
and
panic.
in their frozen stupor, they're kicking away the muck.
Yep.
But,
get out of here.
All right, good plunge. Time to shiver. Time to shivvies. For good measure, I'm going for another donkey.
Get it. Get it.
Yeah, baby.
Good for the soul. Good for the soul.
There's nothing better. Seriously, I feel like $1,000,000.
You give me
Nerve pain says what?
the best Colombian coffee, the best conversation, the best environment, and nothing's gonna wake you up like that does. And like get things going.
True story. Way to go.
Bam!
So, Reid, how do you feel?
I love that. I love cold plunges. I love that little shock to the system. It's awesome.
It is. It's such a glorious, easy challenge for your body that has countless benefits.
Yeah.
And you know, when we were walking back from on the infamous walk from the dock, you were telling me about a unique challenge that I'm not quite familiar with. It's Misogi. Is that right?
Yep.
Tell us a little bit more about this.
So I read this in a book, and I wish I could remember what book it was because I'd like to give this guy credit. I want to say it was Atomic Habits or Killing Comfort. I can't remember which one it was. But I was reading this book at the same time that I was planning this, what was already a Misogi, I found out. And there's 2 rules to Misogi. One is don't die, and he's very serious about that because this guy talking about it in the book, he did
Good rule.
a rim to rim to rim. They did with one of the NBA athletes that he was training. They did like underwater, walked, I think it was a mile. Like, so they get this rock, go down underwater, walk for 50 steps, come up, get air. Next person go down, walk for 50 steps, come up and get air. Like,
Damn.
Yeah, don't die when you're doing that, right? But at the time, rule number 2, forgot about that one, is there has to be like a 50% chance of failure, right? Like you could not complete it. You have to tap out or give up, right? And so at the time, I was already kind of mentally planning this run of mine. My aunt had just passed away from ALS. It's a sad, debilitating, miserable disease. I hope nobody has to go through that. She always wanted to run a marathon with me, and I hate running, so I was like, absolutely not, right? But she always wanted me to do it. Like, even after she couldn't run anymore, she still wanted me to do it. So after she had passed, I was like, you know what? She carried this big weight of ALS. I think I can do that. I'm going to run a marathon. Then I started thinking about it. I'm like, I'm an athlete. It's not that hard to run a marathon, right? So I decided to carry that weight and throw a 40-pound vest on top of that too. So running a marathon with a 40-pound vest on. So I'd already been planning that, like that challenge and something to look forward to and push your limits is like, I think it got me through a lot of shit. Like the mental side of things, the physical side of things, because I still had to train a little bit. I didn't just go dry into it, but successfully did that. You know, I think hopefully made her proud up there in heaven kind of thing. Raised a bunch of money for the ALS Foundation in Minnesota. And what I kind of advocate for a lot of clients, patients, friends, anybody I bump into is like, challenge yourself. Like get out of your comfort zone way more often. Even if that's something small, like jumping in the lake and doing that once, right?
Absolutely.
Or, you know, with patients wise, I always tell like this month, I'm going to remember this time, is this month I'm doing 1,000 minutes of planks, right? Side planks, normal planks, bunky planks, like any variation.
I love planks.
Yeah.
Plank a day keeps the back pain away.
And it, like, especially if done properly, right? Like tuck that pelvis underneath. If somebody tells me they can hold a plank for 8 minutes and they don't look like they can hold it for 8 minutes, I'm like, congrats, you're doing it wrong. You're getting a hell of a shoulder workout, right? Like, you should be shaking after the first 30 seconds if you do it properly. Yeah, so 1,000 minutes of that. We've done in the past 1,000 pull-ups, 1,000 back squats, 1,000 everything. I just like 1,000 because it keeps me on track with it. Sometimes it's harder than others, but got to get them in. So.
No, that's awesome. Yeah, I like that you said you just, you know, even if it's not the physical challenge, just go and jump in a hole. You know, ever since we started doing this, I have so many people that are just like, you'll never catch me in that thing. And I'm like, why?
Yeah.
You know, you don't want to do something that's good for your body, or you just want to just take it easy all the way through.
Right.
Push yourself. Misogi.
Misogi, yeah, there you go. And like getting people out of their comfort zone, whether it's a difficult conversation with a loved one, like it's going to inspire change. Like we have to get away from comfort. We live in a 72 degree, constantly heated, constantly cooled status with cushiony shit on our feet. Like get uncomfortable and push yourself a little bit. So
I like it. Well, I'm going to Misogi. I'm going to figure out my Misogi.
I
hope all you are already figuring out yours. And Reid, this was a blast.
Yeah, man.
Sweating with you here today. And I look forward to, you know, we're going to have an event, the two of us, in the next couple months here at Back Channel as kind of a prelude to Spring Park Awakening 2025, which is going down August 3rd.
Yep.
That's our Sunrise Wellness Dance Festival. It's incredible. But in the meantime, thank you again.
Of course, man.
And I look forward to the next time we get to sweat.
Thanks for having me.
Cheers. We'll see y'all soon.